Welcome to Meridian Med Spa. My name is Veda. I'm going to be your technician today. So I see that Lynn brought you in and got you all set up with a gown. Okay. And did you want anything to drink? No. Okay. Just making sure you were offered. So I see that we have you scheduled for laser hair removal treatments today. Okay. We have one small area and two medium areas. All right. Small area is upper lip, okay, and your medium areas, underarms, it's a really popular area, and lower arm. Okay, fantastic. That's a good assortment of areas. Now, I know that you have at least one session paid for and booked. Did they talk to you at all about packages? Okay, not yet, but you wanted to talk about them. Yeah, so we have packages of 3 treatments and 6 treatments. We recommend the package of 6 because that is generally the number of treatments you'd need to see a 70 to 80% reduction in the hair in the area. Yeah, the reason for that is that your hair grows in different phases. So it doesn't all grow at the same time, and if we treat it over a period of 6 months with 6 treatments, we should be able to get almost all of your growth phases to eliminate as much hair as possible. And then if you need future treatments going forward, we do offer them at a discounted price. Okay, so our package for the medium area is, so for one treatment, it's $75. For 6 treatments, our package is $400, so that would cover one medium area. So for 2 medium areas, it would be $800, and we'd be able to subtract what you've already paid from that price and prorate it for you so that you're not paying for a full session and then 6 more full sessions if you'd like. Okay, and then for a small area, the package is $200 for 6 treatments. One treatment would be $50, which you've already paid. Okay, so I can write that down here, and before you leave, we can upgrade that package for you with Lynn at the desk and set you up for your next appointments. Awesome. So we'll talk a little bit about how the laser works, but first I'm just going to ask you some questions to make sure that you're a good candidate for the procedure. Okay. Most people are. Your skin tone falls within the viable range, so that's good. Unfortunately, our lasers aren't able to work on very dark skin tones, and that's because they do target the melanin in the hair follicle, so that pigment, and with darker skin tones you're risking burns and stuff, and they just don't work. But with your skin tone and hair color, you will be a great candidate. Generally, the lighter the skin, the darker the hair, the better it works. Okay, so let me just see here. I have your name and date of birth. Put down your areas to be treated. Do you have any allergies to any prescription medications or drugs? Any allergies to makeup? Okay. Foods? Okay. That shouldn't be an issue. And any skin allergies? Okay. All right, so none of that should affect the laser procedure. And are you currently taking any medications? No, okay. And specifically, you are not taking any medications that cause sensitivity to sun. Okay. The reason that we're extra clear on that is this can be similar to sun exposure in the way that it affects your skin, and if you are photosensitive in any way, particularly from medication, it can cause damage to your skin, such as burning or ultrasensitivity, and we want to stay away from that. Do you use, or have you ever used, Retin-A or Accutane? Okay. Do you have a history of autoimmune disease or an immune disorder that would impair a healing process? Okay. Are you prone to cold sore outbreaks, especially where we're doing the upper lip? Okay, good. The reason I ask is because this can trigger cold sore outbreaks in certain people, especially those that get cold sore outbreaks from sun exposure. So if you were, we would be able to prescribe Beltrax in order to limit the chances of a cold sore outbreak. Are you pregnant? Okay. Do you have a history of keloids or hypertrophic scars? Okay. When you do get a scar, is it generally significantly dark in color? That just helps us determine their type of skin and how it deals with any sort of trauma to make sure that we're not going to have hyperpigmentation from the laser. It's very rare. Okay, do you have coarse or fine or medium hair? Okay. And your skin type, would you say it's oily, normal, combination? Okay. And do you have sensitive skin? A little bit. Okay. So the most that this would likely cause is some redness that can last up to a day or so. Generally, it goes away pretty quickly, and it might be similar to a very, very light sunburn. It shouldn't be particularly painful, but where you have sensitive skin, how's your pain threshold? Very low. Okay. Have you ever had wax or plucking? Okay, so that's very painful for you. All right. What we can do is apply a topical anesthetic cream to your skin today, a lidocaine cream, in order to numb the area and make this a more pleasant procedure for you. Okay, so we can do that. I'll do that right after we finish this questionnaire, and then we can talk about the laser while that takes effect, okay? Do you have any implants, injectables, permanent makeup? Okay. Any tattoos? Have you ever received laser treatment before? And have you ever received a cosmetic peel or other cosmetic procedure? Okay, you said you've tried waxing and you've tried tweezing. Have you waxed or tweezed the areas in the last 3 weeks? No. Very good. Okay. The reason we ask that is because we want to make sure that you're in the growth phase for all of the hair that is apparent. If you have waxed and pulled out follicles, we're not able to target those follicles with the laser. So it's better if you just shave right now. No waxing or plucking until the procedures are all complete. Have you ever tried electrolysis? Okay. Any bleaching? Okay. And same with waxing and plucking. If you were to bleach your hair, we ask that you do not do that during these 6 months of treatments, just because it does target the melanin in the hair follicle. So if you bleach it, it doesn't target that follicle. Okay. You said you have shaved. And okay, do you currently wear SPF? You do. Okay. Yep, just make sure you continue using that. Sun exposure should be limited after the use of laser hair removal because you will be more sensitive to the sun. I don't want you to burn. And absolutely no tanning for at least 7 days afterwards. Okay, good. Yeah, we recommend no tanning anyway because it's very bad for the skin. Do you use a moisturizer? Okay. Let's see. And no photosensitivity disorders. Okay. Lovely. And no bacterial infections right now. Okay. Just for sanitary reasons. All right. So it looks like you are a perfect candidate for the procedure and we're able to start today. I'm going to go ahead and use the lidocaine on your treatment areas now. It does take about 10 or so minutes to take effect, so we'll get that on there. 5 to 10 minutes. So I'm going to put that on with these cotton pads. We'll just put it on your upper lip and underarms and arms. Okay. And you don't need to use the restroom or anything before we start. Okay. And you don't want to drink. Okay. Just making sure. Okay. Get that on there. It's a little cool to the touch. Get that on there. Yeah, thin layer is all you need. And what we'll do for next time, because it usually stays effective for about an hour and a half to 2 hours after application, we'll get you a bottle of this that you can take home with you, and you could apply it yourself right before coming in. That way you don't have to wait for it to take effect before we do the treatment. So you can do it yourself, and we can start right away when you come in. Okay. I'm going to do your left underarms. If you could just raise your arm for me. Thank you. Okay. The most sensitive area for you that we're doing today is going to be the underarms. Just because it's a sensitive area anyway, and generally the hair growth is denser there. And raise your right arm for me. So the denser the hair is, the more of a sort of a zap you'll feel. All right, very good. Do your arms. The least painful will most likely be your lower arms, just because it's not an extremely sensitive area of the body. Have you ever waxed your arms? You have? Okay. And was that less painful? Yeah. Generally, the most painful areas that we treat are going to be the pubic area, bikini area, and the same. Those are the same. And the underarms are usually the most painful. If you ever do want to do the legs are usually the least painful, extremely bearable, followed by the arms. Okay. So we'll just give that a couple minutes to take effect, and in the meantime, I can show you the laser and explain a little bit about how it works. Okay, just grab that. I'll be right back. Okay. So this is the laser that we'll be using. When I press the button, it turns on. It does have an automatic function, so as I move the laser along your body, it will be flashing and making a little light click sound. You'll hear a little fan when I turn it on inside. That's a self-cooling function so that it doesn't overheat, and it also keeps the tip here cool for you and comfortable on your skin. This has levels 1 through 5 on it, and I'm going to start you on level 3 on the upper lip. We'll start you on level 4 on the arms, and level 2 on the underarms, and see how that feels for you. If you are comfortable enough, we can increase the level. The higher the level, the more effective the treatment is, but level 5 can be a bit painful for the first time. Generally, we would increase the level over the course of your treatments as you get used to the laser. Okay. So, as I was saying before, it sort of flashes the pulse here from the laser. It's going to target the melanin in your hair follicle, and that damages or kills the hair follicle over time so that it cannot produce more hair. And it can only treat hairs that exist at the current time. So if a follicle isn't in the active growth phase and there's no hair in it, it cannot be treated, which is why we have to do multiple treatments to catch all the follicles. After 6 treatments, you should see a 70 to 80% reduction in hair growth, which can be phenomenal for most people. Do you ever suffer with ingrown hairs? Yes. Okay, so a major reason for getting this treatment for some people is to eliminate ingrown hairs. If we reduce the amount of hair growth, there's a lot less chance of it getting stuck within your skin because you're not going to have that density of hair in the area. And so that'll eliminate your ingrown hairs. It's really nice, as well as eliminating a lot of the hair that you do have. So that's the laser. That's how it works. We schedule your appointments 4 weeks apart, roughly. Can be 3 to 5 weeks apart is fine if you have something going on. And after 6 months, you should be almost hair-free, but if you do want to schedule more appointments after that for touch-up treatments, they are at a reduced rate of 50% off. So if you wanted another 6, you could get another 6 of a small area for $100, another 6 of a medium area for $200. You can even split those treatments. So if you wanted 6 of a medium area and you wanted to use 3 of those treatments on the underarms and 3 on the arms, you can do that. So it's a nice feature, and the satisfaction rate for this procedure is extremely high. Most people are very happy with it. Yeah. Do you have any questions about it? So the pain level is pretty low in terms of cosmetic procedures. You will feel sort of, some people call it feel like a rubber band snapping, but I feel like it's more of a zap, like you're being zapped with a small electrical current, or sometimes you can feel the heat of it. It is very manageable and it dissipates immediately, so it's not going to linger. For the first 24 hours after the procedure, no deodorant on the underarms, and stay away from any heavily scented creams. You can use regular face lotion or unscented lotions, but anything with heavy scents, and no deodorant for 24 hours. Yeah. No sun exposure for a week, and I'm very serious about that. Make sure that you're wearing your SPF. We don't want to cause any damage to your skin. Okay. All right. Go ahead and do you mind if I just touch where I applied the cream? Okay, and your underarm. Let me get in here. Okay. Other one. Okay. When I touch that, does it feel relatively numb? Okay, awesome. All right, I think we're ready to start then. So when I start up the laser, you're going to hear the fan on it, and the light will come on. Okay, there we go. Okay, so we'll get it to level 3. I'm going to start with your upper lip, okay? All right. Ready? Okay. Again, it's just going to feel like a zap. Okay. Good job. Okay, that's the upper lip. Upper lip, very easy, very small area to cover. How are you feeling so far? Okay, just a little sensitive, not too bad. Excellent. Okay, now I'm gonna go to your arms next, and we're going to treat on a level 4 for the arms. Let me know if this feels uncomfortable, okay? All right, you ready? Okay, let me start on your right arm here. Okay. You're doing an awesome job. So what made you choose to do laser? Okay. Yeah, that's great. You know, I've heard of people doing it because they have beach vacations a lot. And they're tired of taking time out of their vacation to shave their legs or anything. And then just people that have sort of struggled with body hair for their whole lives. They're tired of the maintenance. How does that feel? Okay, still doing okay? Okay, we'll keep going. The arms are not too bad. Yeah, I've had it on my arms, legs, underarms, upper lip. I'm Italian, so be a hairy person. But I found the legs to be very much the least painful than the arms, like I said before. Okay. Let me know if you need to take a break, okay? So after the treatment, you'll have sort of like a honeymoon phase where after about 1 week, the treated hair will fall out and you will be completely bare for usually a couple weeks until the other hair starts growing in from the new growth phase, which is really, really nice. And then once that hair grows in, you can shave as normal. Just no plucking or waxing or epilating, anything like that. Oh, have you tried an epilator? Yes, I found epilators to be the most painful, way more painful than waxing. Okay. Have you tried sugaring? Yeah. No, when I was a teenager, I found a recipe for sugaring, so I tried it at home, and it was just sugar, and I think just sugar and lemon juice and water, and you heat it up to make it sort of like, you know, gel-like almost. It didn't work for me. I could never get the consistency right. And I always wanted to eat it. Not when the hair was in it, that's gross, but. Okay, so that's your right arm done. Gonna come over to your left arm. Okay. You're doing awesome. I'm avoiding any freckles that you have because they could burn, because it targets the melanin in the skin, that pigment. Freckles can be spots that end up burning or even scarring if you're not careful around them, because the laser will target them, and don't want that to happen. So just working around those, but don't worry, getting nice and close to them so that it will get the hair. You're doing awesome. Now, I think it's funny that there's so many different methods of hair removal. Oh, we didn't even talk about threading yet. Have you tried threading? I think I tried everything when I was younger. Again, I couldn't get the hang of threading myself, and I never went to a salon or anything to have it done. But I see those in the mall now, kiosks and stuff where they do it, and they seem so fast. That's generally for just the face though, huh? Eyebrows and lip. Very nice eyebrows. other services here. So laser is one of our most popular, but we also do Botox, we do fillers, we do skin resurfacing, we do facials, just like a spa, we do massage. I can get you a pamphlet with all of our different services on the way out if you're interested. Yeah. Yeah, we want it to be a comfortable experience for you. The med spa environment can be really nice because even people who might be a little bit uncomfortable at the doctor, if it feels more spa-like, could be less nervous, even if there's needles involved, like with Botox. And with something like laser that can be a little bit painful. Try to maintain a nice, calm environment. Okay, we're almost done here. Okay, fantastic. So I'm just going to set that down for a second. I'm going to let you breathe for a moment, and we're going to move into the underarms. I'm going to do those at the lower level. I'm going to put that on a 2 so that it's not too painful for you. Again, let me know if anything is uncomfortable. Do you need a break? Do you want a drink? Okay. Yeah, I just want to make sure to want to make sure you're comfortable. If at any point during our sessions you need anything or you need a break, just let me know, okay? All right. So I'm going to start on your right underarm. You could just lie your hand above you. Okay. Here. Is that okay? Okay, good. This should be pretty quick because, again, the underarm doesn't have a whole lot of treatment area, so okay. Excellent. So we're going to go ahead and come to your other arm, left arm up. Doing okay? Alright. Just come in here. Okay. There we go. You're doing an awesome job. Okay. Just a few more zaps. I think the numbing cream really helps a lot, so and just make sure to apply that before you come in for your next appointment. If you forget, I can put some on for you, but then you have to wait a little bit, so it's easier if you do it before you come. Almost done. Okay. Just turn that off. Set that down. Okay, are you feeling all right? Okay. So unscented lotions are perfectly fine. You can wash the area, but stay away from heavily scented lotions. Stay away from the sun. 7 days, please. Make sure that you're wearing SPF, especially on exposed areas where you have the upper lip done. Make sure you're using an SPF on your face, okay? Awesome. So we'll get you up front to Lynn so that we can upgrade your packages and schedule your next appointments. Do you have any questions for me? Okay, so she'll also give you the numbing cream up front. Okay, I look forward to seeing you next time. Thank you so much for coming in, and we'll get you a brochure for the other services in case you're interested. Maybe a pampering day where we do a massage and facial. All right, great. I'll see you soon.